And we continue with the healthcare theme here on IGF 2024. And this time we're going to look at the effect of the climate crisis on global health systems. And we all know that climate change is affecting the health of the planet, don't we? But what impact is it having on our own health? That's what we're going to discuss. Are enough people aware of this? Is enough money going into it? Let me introduce you to our great panelists. We're joined now from Geneva by Dr. Maria Neira, director and the person who's responsible really for the environment, climate change and health pillar of the World Health Organization, WHO. Welcome, Dr. Maria. And here in the studio by Dr. Richard Smith, who's the chair of the UK Health Alliance on Climate Change. So, Maria, if I may start with you. Please explain to us, for those of us who are not in the know, we know that heat affects people's lives. Heat waves kill. But what other impacts is the climate crisis having on human health?
Thank you very much. And just to explain on a very simple way, climate change is touching all the pillars that we need to survive and to live. The quality of the air we breathe, the quality of the water we drink, the shelter, and of course the production of food. All of that will be affected. In addition, we have mental health issues, we have food insecurity due to the extreme weather events, we will have vectors that transmit diseases like dengue or malaria that will find perfect conditions to reproduce and increase those diseases around the world. And of course, we have air pollution, which is killing 7 million people every year and is caused very much by the same responsibles of climate change, the combustion of fossil fuels.
I don't think most people think of climate change in that way. Richard, tell us a little bit about what the UK Health Alliance does. Why did you come together? What are your targets?
Yeah, well, we're an alliance of 48 organisations of health professionals, most of the royal colleges in this country, the GPs, the surgeons, the nurses, the pharmacists. And we came together because, as Maria has just been explaining, climate change and the destruction of nature is the major threat to health. So we as health professionals need to do something about it. So one thing we do all we can to mitigate the effects of climate change, try and stop it happening as best we can. We encourage adaptation, because it's already here. I mean, most health professionals in this country not only know that it's happening now, they're experiencing it with their patients every day. But there's also an upside, because there's potentially a huge benefit to health. If we do the things we need to do to save the planet, like driving less, flying less, eating a diet that's largely based on plants rather than meat, then there are benefits to our health.
Okay, and what is the WHO doing? How are you advocating to bring this message to the world, Maria?
I think we try to touch the whole spectrum. Of course, we produce the scientific evidence that is needed together with professionals, health professionals and experts and scientists. We go to the policymakers, we go to governments with this science, telling them what it will be good to reduce those emissions, what will be the health benefits that will be obtained, and in the case that climate change is already affecting the health of their population, what they need to do to better prepare the health systems to cope with that demand. We go to the COPs, we go to the high-level negotiators, we go to the countries that are deciding on behalf of the environment, on behalf of the climate change. They are deciding how many degrees or what is the proportion of emissions they can reduce. We are telling them that they are negotiating with our health as well. That's why we go to the COPs very strongly. Last year, we managed to get the health community with us, supporting the first ever health day at COP28. We go to parliaments, we mobilize the health community, which is great because, as you heard from my colleague, is fantastic of how the health community, the health professionals are now going beyond treating the cases and the diseases caused by global warming. They want to do more, they want to mitigate, they want to be part of this big effort of reducing emissions. We monitor, we mobilize funds. I think we are trying to touch every single piece of this complicated puzzle, because health is very much at risk if we don't take the right decision. But health can be enormously benefited if we take the right decisions and we invest on mitigating climate change, because the health outcomes could be enormous, will be the best public health agenda ever.
Well, I'm persuaded, Maria, but are global leaders listening? Have they woken up to the threat to human health from climate change?
Well, I think they've been a little slow. I mean, as Maria said, last year it was the 28th annual meeting of the UN to discuss climate change. And as Maria just said, that was the first year that health was on the main agenda as opposed to a side meeting. So I think we've got a long way to go. And I think to some extent us health professionals must take some of the blame. We've sort of talked to ourselves too much. We need to get out and speak to parliamentarians, to ministers of transport, get beyond our comfort zone. And that's what we're beginning to do. I mean, in this country, you see quite a lot of doctors, chaining themselves to railings, taking direct action because they feel that we've been so slow in responding to this huge threat to health. And we're not doing very well, to be honest. I mean, we're supposed to be keeping the global increase in temperature below 1.5 degrees, but it becomes quite apparent that's not going to happen. And
indeed, so the climate crisis is here, isn't it? We're not just talking about mitigation, we're also talking about adaptation. How do we deal with the consequences of climate change? And I believe that a minuscule amount of the adaptation funds available, let me just take a look, I think it's something like 0.3% of global adaptation funds are being directed to support healthcare. That's extraordinary, Maria.
Extraordinary and really shocking, because the arguments cannot be more powerful. I think the health argument is the one that can motivate more action and more ambition and more speed on climate change, on taking action on climate change. And the reasons are so important. We need to prepare our health systems to cope now with the impact, the very negative that climate change is having on our patients. And the funds are not reaching there. When we look at that, we did this survey on where are the climate financing going. We realized that for the health system, for the health services, is less than 1%, while in many countries they are already observing an important increase on many vector-borne diseases, waterborne diseases, issues related to malnutrition, food insecurity, scarcity of water. And of course, we see as well the heat waves that are accelerating now, increasing incidence and destroying, and again, the health of our
saying
people.
That more money needs to be spent on healthcare systems in order to bolster them against these threats.
We need to mobilize the financing, the multilateral banks. I am coming back from China, where I have the honor to talk to the Asian Infrastructure Investment Board. They need to understand that those investments on a sustainable health system, climate resilient, reduction of pollution in the countries where they are working is fundamental. And the benefits for the economy, for the business as well, not only for the health of our people, will be absolutely paying many times more the initial investment you need to put up front.
Thank you very much, Maria. Richard, you were saying earlier that the climate crisis is the #1 healthcare risk, but I don't think most people think that. They think it's non-communicable diseases, stroke, cancer, dementia, that sort of thing. So how are you going to get this message across that actually it's something which is, at a different level altogether?
I think it is dawning on people. I mean, I think perhaps you're right. People haven't tended to conceptualize this as a health crisis. Certainly, we've got a heat wave here at the moment. We see floods, which affects people's mental health. Lots of young people are very disturbed by how the future looks. So I think it is getting through to people. And I mean, the health system itself is part of the problem as well as part of the solution, because in this country 5% of greenhouse gases come from the NHS. So we've got to change our health system to make it more adaptable, but also to make it more effective and be able to respond to the problems that are coming.
Oh, that's fascinating. So the healthcare system itself needs to reform itself. That's really good. I'm going to ask you, Maria, for one last message to us all. We're here looking at the big themes shaping society going into the future.
Yeah, this decarbonizing of the health system or greening the health system is giving a lot of enthusiasm and motivation to the health professionals, because they feel that they can contribute with something substantial. We can do better procurement, supplies, making all of our care and telemedicine and reducing our carbon footprint. This is one thing, but we need to advocate for those messages that will make people understand that our health is at risk now, or it can be enormously protected if we mitigate climate change. We have a major responsibility as a health professionals to lead this climate change acceleration on the mitigation and adaptation, because very much our health is in the middle of these negotiations, and people is not aware of that. So we need to make sure that everybody will wake up, no excuses. We need to stop this. Otherwise, we will be paying an enormous price. And it's not the planet, it's our lungs and the rest of our body and our mental health as well.